your gums bleeding, or do you constantly have plaque placed in between your teeth? Despite brushing every day, most of us were taught to brush in large circles, which damages enamel on a daily basis. Hi, I am Dr. Veena, General Dental Surgeon at ASHIRVAD Dental Clinic, KUDUR, Bangalore South District. And today I will be teaching you the modified vase technique, which is easy to master, and let us learn that together. Before we start brushing, let's understand why this is called as the modified vase technique. Plaque doesn't just sit on the flat surface of the tooth, but it sits in between the sulcus, the tiny gap between the tooth and the gums. If left alone, it can lead to gingivitis, which means the gums becomes inflamed and swollen in nature. This technique is specifically designed to get your tooth bristles exactly where they need to be. Grab your toothbrush. I would highly recommend you use a soft bristle toothbrush to protect your gums. We are going to break down it into 3 simple movements: the angle, vibration and sweep movement. The first one, angle. Place your toothbrush at 45-degree angle pointing towards the gum line. Make sure that the bristles are half on the gums and half on the tooth. Second, the vibratory motion. Press gently, don't scrub. Gentle wiggle or vibrate the brush back and forth for about 5 to 10 seconds. This forces the bristles in between the gum pockets. Sweep. Finally, roll or brush down, up and down between the gums so that the food particles which are trapped in between the teeth are. Finally, roll the brush or use the sweeping motion for the upper teeth from the above teeth to the lower teeth, and for the lower teeth the movement should be upward motion. This removes the plaque from the sulcus area. Just a small point of view that if you want to master this technique, do stand in front of the mirror till you master this brushing technique. Now let us start the movement to cover the entire mouth. Keeping the brush at 45-degree angle, vibrating gently on the tooth, covering 2 or 3 teeth at the same time, and then using the sweeping motion. This way you need to brush the whole of your mouth using the same motion. It will take you about 2 minutes. And the rule is to brush twice a day, morning and night. Rinsing of your mouth after each meal. And visiting your dentist twice a year to eradicate or to get to know what are the dental issues that you have, so that we can do the treatment as soon as possible. So for brushing on the inside of the mouth, use the same motion. You need to use the vibratory motion on the tooth surfaces. Just covering 2 or 3 teeth at a time, and use the sweeping motion from inside to the outside surfaces. Use the same technique for the whole of your mouth. It would take you time to master the technique, but it's a very easy technique in general that we usually recommend to our patients on a daily basis. The same goes for the upper teeth. On the inside surface, first clean this surface of the tooth so that all the remnants of food are removed. Then gently use this swiping motion to remove the tooth that are placed in between the tooth and the gums so that nothing is entrapped. Do the same thing. Use the toothbrush in this way for the front teeth. Be very gentle while brushing, never harming the gums, as even tooth bristles, if they are pressed harshly against the gums, can lead to gingival inflammation. That is, you will have bleeding gums. Patients think brushing vigorously is going to give them a cleaner and brighter smile, but that is a no-go. Using a hard toothbrush vigorously on your tooth surfaces causes lot of issues, mainly dental abrasions, which means the gums which are supposed to be in this place come down and this portion of the tooth is worn off. So the first thing that we do is give them a desensitizing toothpaste so that the sensitivity is worn off. If it reaches a point where the sensitivity is not wearing off even after using a desensitizing toothpaste, we use dental cements to cover the abrasions. If the patient complains of pain and unbearable sensitivity, then we advise the patient to go for a root canal and a cap. So, brushing hard is not going to give you a sweet and smoother smile. Never use a hard toothbrush. Small changes in your brushing technique makes big difference in your overall oral health. Oral hygiene takes time, but once you have mastered this modified brush technique, it will be easy for you to brush on a daily basis and your gums are definitely going to thank you. Do like and subscribe to my channel, The Tooth Talk Studio. Thanks for watching.